The first patient is a 52-year-old woman with type 2 diabetes for 7 years, who's obese and started basal insulin a year ago. She has a BMI of 32, blood pressure 127 over 82, A1C of 8 with a GFR of 75. She's been taking metformin for several years, was on other oral agents which would stopped and then glargine added, and she's up titrated a little bit to 22 units. She takes drugs for blood pressure and hyperlipidemia. She's adherent to her medications, but she's very busy working full-time as a nurse and taking care of her sick husband and feels she's overwhelmed. She's most frustrated about the 10 pounds of weight gain that she's since starting a year ago. When you hear that story about weight gain, John, what do you think about GLP-1 receptor agonists?
Well, I think that that's a great combination. She's not at goal. A1C's 8%. She's on maximum dose of metformin and glargine, so she really wants to try to.
Well, let me stop you there.
Okay.
You know, she's not on a lot of glargine, and the gut feeling of many docs looking at the A1C and a fasting glucose will say, well, you know, we have the treat to target trial. You could titrate this, and I tell all my patients to self-titrate and try to get the fasting glucose down to 150. I think she could get there. She could easily get to a fasting glucose down to 100 and A1C with around 7%, maybe with or without a little hypoglycemia, but her insulin dose is probably going to be about 45 or 50.
Right.
And she'd probably gain some more weight because she's probably, although she says she's adherent, with her lifestyle and you know, family issues, etc., she's probably not adhering to a diet and not exercising enough. She will gain more weight. And since that's so important to her, I think we need to pay attention to it.
I agree. I completely agree. I think that is a real barrier. I mean, she's not having hypoglycemia as a barrier. She's frustrated with the weight gain. So when you come in and say you need to push the insulin further, my guess is she's going to give you tremendous pushback. Right. So the key is for us, how do we solve this problem for her?
And then if you tell her, how about another injection, she's going to say, you know, I've got enough to do. I have such a busy job. I have so many things to do. So I think a combination therapy may be very appropriate. Would you agree with that?
I would absolutely agree with that.
Now, you know, some people would say, what about an SGLT2 inhibitor? And I think that's not unreasonable as well. No. But in general, the weight loss that you would get with that is a lot less than the weight loss you could potentially get with a GLP-1 receptor agonist. Now, not everybody would lose a huge amount of weight with SGLT2 inhibitor, but with GLP-1 receptor agonist, it's very variable, and she may be one of those lucky ones.